So firstly, I'd like to thank GETA in conjunction with the Epilepsy Foundation for asking us to speak tonight about ketogenic diet therapies. So I'm Brialie Forster, the clinical nurse consultant for developmental and epileptic encephalopathies. And I work within the ketogenic diet team here at Austin Health. And this is my colleague Shea Godsil, and she's the ketogenic dietitian. So Professor Ingrid Scheffer is the clinical lead at Austin Health for ketogenic diets, and we treat both children and adults within our service, so it's quite unique. So ketogenic diet therapies is an established treatment for drug-resistant epilepsy and proven efficacy, and is now being used to treat other neurological disorders and select cancers. So this evening, what will we be covering? So we're going to look at the history, indications and efficacy of the diet, and also the different types of ketogenic diet therapies, and we're going to end with some practical considerations. So I thought it's important to mention that ketogenic diet therapies should not be commenced without medical and dietetic supervision, as it's not a natural therapy. Ketogenic diet therapies must be medically supervised to prevent the potential side effects, which we'll explore later on in this presentation. So this presentation is a general information session only and should not replace discussions with the treating neurologist or your ketogenic diet team. So now let's look at a little bit of history. So the history of the ketogenic diet is quite interesting because it's been dated back to biblical times, where prayer and fasting was reported to cure seizures. In 1922, the ketogenic diet was first used to mimic starvation. So carbohydrates were restricted and an increase in fat intake. However, in 1939, with advances in drug therapies, there was reduced interest in the diet. Until in 1994, the ketogenic diet experienced a resurgence following the NBC TV's Dateline report on Charlie Abrahams, who became seizure-free with the ketogenic diet. The Charlie Foundation was founded to provide information about dietary therapies for people with epilepsy. And in 2004, Matthew's Friends, a UK charity, was established. Today, they help children and families all across the world using ketogenic diet therapies. And in the early 2000s, Dr. Eric Kossoff from Johns Hopkins Hospital proposed a more liberal version of the diet, the modified Atkins diet. There has since been other ketogenic diets introduced to treat epilepsy. So just to look at the ketogenic diet multidisciplinary team. So here at the Austin, our team consists of 3 core members. So we have the neurologist, which here is Professor Ingrid Scheffer, and she provides medical monitoring and medication management. We have the dietitians, and they provide diet prescription and ongoing diet management and education. We also have the nurse, and we have a few nurses in our team, and they provide care coordination, education and support. Apologies, we just have a code.
Medical emergency team to 6 South ONJ Centre, Nuclear Med Unit. Medical emergency team towards 6 South ONJ Centre, Nuclear Medicine Unit.
I do apologise, we're currently in the hospital. And we also resource support from pharmacists, GPs and other allied health professionals as required. So eligibility for ketogenic diet therapies is mainly based on the underlying condition. We know there is some conditions that ketogenic diet therapies should be considered very early on in the course of treatment. An example of this would be GLUT1 deficiency and PDHD. The International Consensus on Diagnosis and Management of Dravet Syndrome, published this year, recommends dietary therapies after failure of 3 to 4 anti-seizure medications. They recommend the classical ketogenic diet for less than 6 years of age and the modified ketogenic diet for teens and adults. Other syndromes include Angelman syndrome, infantile epileptic spasm syndrome, tuberous sclerosis complex, and epilepsy with myoclonic atonic seizures. There are several other conditions that not listed here, but are also proven to respond, including Lennox-Gastaut syndrome, Rett syndrome, cortical malformations, to name a few. Please speak to your treating neurologist to see if the ketogenic diet therapies is appropriate treatment option. The treating team also needs to take into consideration the feasibility of the family to manage the diet in the home, and this is usually done in collaboration with the family. I'm not going to spend much time on this slide, but it just shows a list of conditions with inborn errors of metabolism that the ketogenic diet's use is contraindicated in. Therefore, it will not be used. So now let's look at how effective the diet will be. Rate of response is defined as greater than 50% seizure reduction. A meta-analysis, which is a statistical analysis that combines the results of multiple scientific studies of 19 observational studies, found after 6 months, approximately 60% of children on the classical ketogenic diet had a greater than 50% seizure reduction, with 30% having greater than 90% seizure reduction. However, there is also other benefits that have also been reported, and these include a quicker recovery from seizures, shorter seizures, reduction in the use of emergency or rescue medications, improved mood and cognition, and increase in energy. And these are some of the benefits that parents always report to us after initiation of the diet.
This slide is as scientific as we're going to cover today, but despite ketogenic diets being widely used in the management of epilepsy for a long time now, the mechanisms of how the diet works still is not well understood. Ketogenic diets are metabolism-based treatments that induce a broad range of biochemical, hormonal, cellular, and physiological effects. Therefore, the relevant therapeutic mechanisms are likely multiple. Significantly increasing fat intake in the diet and restricting carbohydrate causes a switch in the body's metabolism, whereby fat becomes the primary energy source and ketone bodies are produced. Hence, we use ketone testing as the primary measure of the level of ketosis in the body. How ketogenic diets work for each individual is also likely dependent on diagnosis. For example, in GLUT1 deficiency, which we know the ketogenic diet is recommended as first-line treatment, the ketone bodies provide an alternative source of energy for the brain, bypassing the impaired glucose transport across the blood-brain barrier. The mechanisms for how ketogenic diets reduce seizures is an ongoing area of research. There are different types of ketogenic diets. Most of you are probably mostly familiar with the classical ketogenic diet. Which diet we recommend is based on individuals and is also center-based. The modified Atkins diet was initially adapted from the weight loss Atkins diet and designed as a more liberal diet compared to the classical diet. Over time, this has been adapted to the modified ketogenic diet. As a very broad statement, the classical diet is typically used with children and those that are tube-fed, and the modified diet is used for adolescents and adults, and it is a little bit more liberal. That said, we have a number of adults on our program who successfully manage the classical ketogenic diet. The medium-chain triglyceride diet and the low glycemic index treatment are less commonly used in ketogenic diet therapies. They're more commonly used overseas compared to Australia, but less widely used compared to the classical and modified diets. I'm not going to spend a lot of time on these diets today, but just so you're aware, the medium-chain triglyceride diet, as the name suggests, focuses on medium-chain triglycerides. MCT fats are more ketogenic than short and long-chain triglycerides. The medium-chain triglyceride diet contains around 60% of energy from MCT fats. The low glycemic index treatment allows more carbohydrate compared to other ketogenic diets at 40 to 60 grams per day. However, more focuses on carbohydrates with a low glycemic index rather than being a high-fat diet. The low glycemic index diet is offered in some overseas centres. I'm not aware of any centres in Australia who offer this diet. Today, I'm going to focus just on the classical and modified ketogenic diets, as these are the ones offered at our service and by far the most commonly diets offered throughout Australia. So focusing more on these diets, these pictures are helpful to compare the macronutrient profile of the different diets. To put these comparisons into context, a normal diet contains approximately 30% fat, 50% carbohydrate, and 20% protein. So you can see that each of these diets significantly increases the proportion of fat in your diet compared to a regular diet. And with using this much fat in the diet, fat becomes the principal source of energy for the body, which is usually carbohydrates. Consistent across all these keto diets is the focus on restricting carbohydrate intake to around 5% of your energy intake. These diets do differ in protein, as the classical diet restricts protein intake to your minimal biological need. In a Western diet, we overconsume protein compared to what our body actually needs. The modified Atkins diet is higher in protein, as like the original Atkins diet for weight loss, it encourages the consumption of protein, whereas the modified keto diet does not restrict protein, but we don't encourage the addition of extra protein into the diet. So the classical ketogenic diet, it is generally calories are prescribed, which means that for each meal and snack, you are told how many calories you need to include. Fat intake is very high at approximately 90% of your total energy needs. Carbohydrate intake is extremely low. Generally, it would sit below 15 grams of carbohydrate a day. And as I mentioned, protein is adequate but restricted. So we ensure we monitor for adequate growth and to achieve weight maintenance where appropriate. All food in the classical ketogenic diet must be weighed and measured to the grams. So you can't just add an extra bit here and there or take a little bit out. Historically, the classical ketogenic diet was initiated in hospital over 4 or 5 days. However, in recent years, more centres are using an outpatient initiation approach. Our centre uses a combination of these based on the individual and what is felt to be more appropriate. For the modified ketogenic diet, calories are unrestricted, so we encourage individuals just to eat to their appetite. Though protein is not restricted, we don't encourage the overconsumption of protein, as this can affect ketosis. Fat intake is still very high, so you must add additional fats into the diet. So it's about 65 to 80% of your total energy needs. And we teach individuals to count in fat portions using household kitchen measurements like measuring cups, measuring spoons. Carbohydrate intake is very low, so we do measure amounts of carbohydrate, but we teach people to count carbohydrates similar to how someone with diabetes does who uses insulin. So we usually start kids on around 15 grams of carbohydrate and adults on 20 grams of carbohydrate a day. To put that in context, usually a piece of bread's around 15 grams of carbohydrate. So it's still very low in carbohydrates. And the modified diet tends to always be initiated as an outpatient over a number of days. I will just explain our ratios in keto world. So the classical diet typically works in a 4-to-1 ratio. So ratios is the amount of fat compared to the amount of protein and carbohydrate combined. So for example, in a 4-to-1 ratio, for every 4 grams of fat in the diet, there was 1 gram of combined protein and carbohydrates. Though we don't use ratios as such in the modified diet, to give you a comparison compared to the classical, a modified diet is around 1-to-1 to 2-to-1 as a ratio. We look at the ratios when we are trying to stabilize someone on the diet to achieve adequate ketosis. So if we need to increase the level of ketones in the blood, then we will increase the ratio. Conversely, if we need to reduce the level of ketones, then we'll reduce the ratio by adding in extra carbohydrates and protein. On the modified diet, we tend to adjust the fat content in the diet to achieve this. It's important when following a ketogenic diet that you have a good understanding of which foods contain which macronutrients, so your fats, your proteins, and your carbs. Here we have our high-fat foods, which we make up majority of either the classical or modified diet. Often we're using a range of oils, olive oil, vegetable oils. Rice bran oil is commonly used. Its taste is not as strong as olive oil, so it doesn't become as overpowering. You're often using creams, double creams, mayo, butter, margarine. Also foods like avocado. And where possible, we often encourage individuals to use fats that are healthier to try and assist with our management of cholesterol. For individuals on the ketogenic diet, there's also a number of commercial nutrition supplements that are available via PBS script. More and more, these products are becoming available. So when I started working in keto diets around 10 years ago, we only had a powdered nutrition supplement available, where now we have pre-made drinks, mousses, oils by themselves. So there's lots of different things becoming available to help families if they choose to use them. It's not essential as part of the ketogenic diet to use these products. Some of these products can also be used in baking or smoothies and things like that. So they have really allowed individuals and families to expand their recipes. So our protein foods, these foods also contain fat, though we generally encourage people to choose leaner cuts of meat and get our fat intake from other sources. So we're finding our proteins in meat, fish, cheese, eggs, chicken, as well as nuts, though it's important to note that nuts will also contain carbohydrates, so we do have to count them towards our carbohydrate allowance. Things like almond meal, though, can be really useful to replace flour in some of your baked goods. So our foods that contain carbs, these are the ones that we're not generally able to use much of in the diet. So you're not usually able to use pasta, bread, cereals, or rice in their normal forms, as well as juice. There is some use of fruit in the diet. So we encourage people to choose the lower carb fruits. So that would be things like your berries over your apples and your bananas. Dairy generally isn't included in your keto diets in significant quantities because they contain carbohydrate as well as the protein. So they just eat into that carbohydrate allowance. Though increasingly some of our families are using non-dairy based milks like your almond milks and things like that. So most of your carbohydrate allowance is going to come from our low starch vegetables. So things like your zucchini, your broccoli, your tomatoes, your cauliflower, that's where most of your carb allowance is actually going to come from. Of course, nowadays, there's more and more low carb products available just at your Coles and your Woolies. So this again has helped families on the diet. You can get low carb breads and wraps, spaghettis, low carb pastas. Some families will use things like zucchini noodles or cauliflower rice. So there's lots of things out there that can help someone follow a ketogenic diet. We always also are mindful of hidden sources of carbohydrates. So artificial sweeteners are something that can be included in the diet if someone wants to use them, though we have some artificial sweeteners that we prefer over others. So we always give advice on that. Diet drinks and diet flavored waters can also be included, but again, we always have to be mindful of sweeteners. The other source that we're always looking at for carbohydrates is medications. This includes prescription and non-prescription medications. Even if they're not sweet tasting, they can include quite a bit of carbohydrate. So as a general rule, we're avoiding liquid medications as they're higher in carbohydrate and switching to tablet formations. And if someone's on a ketogenic diet and need to have any medication changes at all, whether it's an antibiotic or something to do with their anti-epileptic drugs, then we always ask that we check with the pharmacy to check the carbohydrate content and calculate that into the diet. So the things that people need if following a classical ketogenic diet. So generally people need some computer skills. All centres will use different programs to calculate classical ketogenic meals because, as I said earlier, everything needs to be weighed to the gram, and a recipe that one individual can follow is going to be different to someone else based on their individual ratio and calorie needs. Many centres in Australia do use this Excel program. There is also a few web-based programs, though generally they're created overseas, which means all their food databases used are UK and American foods. So we don't tend to use those as much in Australia. You're going to need some kitchen scales to weigh all those ingredients. We also go through label reading and being aware of how to read the labels of the food products you use. Often things like silicone bakeware is also useful because it can help ensure that you get all of the product out of your muffin tins and your baking trays. I just wanted to show you today as well some samples of what our meals actually look like, because often when we're talking about a 90% fat diet, people are just imagining oil. So here's a sample of a beef stroganoff as such. So as you can see, where that green circle is, that is mostly where our carbohydrates are going to come from. So you're using very small amounts of vegetables, you know, to 20 grams, only 10 grams of tomato paste. Our beef mince is going to contribute most of our protein, but again, we're only using tiny amounts, 13 grams, to meet our minimum protein need. And our cream and our oil is what we're going to be able to use more liberally to make up that fat content. So this is a 4-to-1 ratio of around 360 calories. Here's just a day in the life of a keto diet. So this would be typically around for a 6 to 8 year old. So again, something like scrambled eggs for breakfast, but that would probably only include half an egg with lots of cream and butter. You can do baked goods, smoothies. We've also got some zucchini and beef rissoles there. So as you can see, the meals don't have to be just swimming in oil as such. The fat can be cooked into them. In terms of the modified diet, so this just shows you how we approach it a little bit differently. We don't need to measure everything to the exact gram. We're more using our household measurements. Both things like tomato, you could use half a tomato, for example, rather than the 13 grams earlier. Your proteins to appetite, so this is like a breakfast cook up, so egg and bacon you can use as much as you wanted to, and your strawberries you'd have to count towards your carbohydrate allowance, and then it'd be important to add the extra fats. So if we wanted to add 3 serves of fat, that would be around 4 tablespoons of avocado, some mayonnaise and some double cream. We also are teaching, as I mentioned, carb counting, similar to how someone with diabetes would count carbohydrates. Previously, people used to use carbohydrate books, though, of course, nowadays we often are using different websites and apps to assist with our carb counting. So this is another example of a day in the life, this one for a modified menu. Again, it's an egg-based breakfast for this one. It's like an omelette, which would have the extra fats added in with some berries. Lunch there looks like a bit of an antipasto, served with some deli meats, olives, cheese, nuts, and some strawberries. And dinner there is like a protein, so salmon with some low-carb veggies, and then with the addition of some avocado or mayonnaise to make up our fat serves. And snacks may include something like berries and cream. Often on the modified diet, people will use a protein-based snack like eggs or tuna as well. If someone is tube fed, we have our nutrition, we have some nutrition supplements that are nutritionally complete, so it's safe to use as the sole source of nutrition. We often use these products as well when someone's starting out on the classical diet before transitioning them over to food. It's important that everyone on a keto diet has to take some diet supplements for extra vitamin and mineral supplementation, because the ketogenic diets are so restricted in carbohydrates. They are not nutritionally complete. So it is a requirement at our centre that people take their multivitamins and calcium to be able to stay on the ketogenic diet. As I mentioned before, often there's carbohydrate contained in supplements, so we do have to be mindful of which multivitamins we use. Centrum's one we commonly use off the shelf. Again, there's also some multivitamins available by script just for individuals on the ketogenic diet. So we have Fruity Vits or Flexivits, and they are a powder that you mix with a small amount of water. Calcium, we typically use something like Caltrate, and then we, as Brialie will talk soon, we monitor for any nutritional deficiencies while someone's on the diet. If you were wanting to do any extra reading on the intricacies of ketogenic diets, I would encourage you to read this book. It is a little textbook. It's quite an easy read, but it just breaks up the diet into all different aspects of its management.
Okay, so what do we cover in an education session to make sure the diet is safe to be managed in the home? So I guess the first one is testing of blood ketone levels. So we recommend twice daily blood ketone monitoring. And we know that blood ketones levels differ across the day. So we usually expect that the ketone levels to be lower in the morning and higher in the evening. And for parents and young children, this can be really overwhelming at the thought of having to do day blood ketone monitoring, but we encourage parents that usually this does become a part of everyday routine once the diet is commenced. So we also teach families and adults how to do testing of urinary ketones. And this is important because it's a good backup just in case they don't have access to a blood ketone monitor. And another really important aspect of the education is illness management, because we know when a child with or an adult with epilepsy becomes unwell, they can have seizure breakthrough. So we need to make sure that families feel and adults feel like they have a plan in place of when they need to escalate care and what kind of illness management strategies that they need to implement. And this can be something like when a child gets gastro, when they need to escalate it and go to the hospital. And we also provide an emergency letter just to make sure that they're not given glucose or dextrose in IV form, and it's just normal saline unless it's life-threatening conditions. Seizure diary maintenance. This is really, really important because this gives the treating team a clear sort of picture, and I'll go through this a bit more in depth in the next slide, a clear sort of picture to work out if the diet is working and when to implement changes, because on our seizure diary, we also write down the ketone levels. Troubleshooting strategies, so how and when to treat high ketone levels, and how to source other equipment that might be needed. These can include ketone strips, because we know they're quite expensive, and sharps containers. So I'm just showing you here the seizure diary that we use at the Austin. So it is one piece of paper and 6 months on each side. And I'll show you an example of one that's been completed for a patient that is on the ketogenic diet. So I don't know if you can see this clearly, but in the morning they write their ketone levels in the top box, and in the evening they write their PM ketone levels, and then seizures in the middle. We also get them to write if they're unwell, so you can see on that top line in January that they'll put on an antibiotic. And this gives particularly the neurologists and the dietitians a clear sense of when the ketones, in what range they're in, and if there's seizures, and when some modifications need to be made to dietary management. So potential side effects, this is really, really important. This is why medical monitoring needs to occur if someone is to be on the ketogenic diet. So these potential side effects can occur during initiation, or they can occur at different times throughout being on the diet. So diarrhea, constipation and nausea and vomiting are some gastrointestinal symptoms that can be experienced. With the constipation, this is usually managed by the dietitian, making some minor changes to some of the fibre that is included in the diet, and also encouraging water intake. So hyperlipidemia, high cholesterol levels, this is something that for adults embarking on the diet can be quite concerned about. And this is usually managed through dietary changes or a referral to an endocrinologist if there is concern. Hypoglycemia, so low blood glucose levels. We usually see this during the initiation phase of the diet, and we don't encourage blood glucose monitoring once the diet has been stabilised. Growth issues in children and adolescents, and this is monitored really closely at the clinic visits. So the dietitians will keep a close eye on growth charts and make sure that the patient is growing adequately and making those gains. So weight gain and weight loss. Some people embark on the diet, particularly adults, for weight loss, and this needs to be a discussion with the dietitian, but is not a goal of being on the diet. And this is when the dietitian makes a prescriptive sort of calorie intake to make sure that weight gain and weight loss doesn't occur. Kidney stones. So we do baseline and 6 monthly renal ultrasounds to monitor for kidney stones. And we ensure all our patients that are on the classical ketogenic diet are prescribed potassium citrate as a prophylactic or preventative measure, just to protect from kidney stones. And bone health, particularly those that are immobile and in wheelchairs, we make sure that they have DEXA or bone density scans just to keep an eye on their bone health. So just to give you a brief outline of the medical monitoring that we complete whilst a patient is on the ketogenic diet, just to monitor for potential side effects, and so we can make appropriate management changes. So within the first 12 months, so at baseline, before the diet is commenced, we do fasting bloods, a urine test, which is a calcium creatinine ratio. It's just a spot urine test, a renal ultrasound, an ECG, and an EEG. At the 1 month mark and 2 month mark, we do blood tests, and at 3 months, we do more fasting blood tests and a urine test, and we do those every 3 months for the first 12 months, but every 6 months, we do renal ultrasound and an ECG. And as I previously mentioned, some ketogenic diet programs will order DEXA scans or bone density scans just to keep an eye on bone health. If any abnormalities are detected, the patient will be referred to the appropriate specialist for further management. So, for example, that could be an endocrinologist or a nephrologist or a cardiologist. Here at the Austin, we haven't had to take anyone off the diet for any abnormalities being detected or any things coming up that need to be, we've just been able to manage them. So now I'm just going to talk a bit about diet compliance, because we know this is really, really hard. It's really hard in children, it's hard in adults, and it's hard in adolescents as well. So diet compliance can also be improved by being prepared. So this starts before initiation of the diet. So the things that we suggest here is to limit temptation. This is especially important for children. So don't have candy or lollies lying around the house or accessible. We also encourage families to be organised, because we know family life can be very, very busy. So we say bulk cooking and freezing once the ratio has been established. That can often help parents on the run to be able to grab things out of the freezer. And we also don't want children to feel like they're missing out on and can be included in activities. So having a supply of ketogenic diet friendly sweet muffins or treats can be put in the freezer, and if they're at school or at a party and food is being given out to celebrate someone's birthday, at least the teacher will then have access to something that that child can eat and they feel included in that celebration. Some families have provided the kinder or the school with a small box of little toys, and as an alternative, the child can choose something out of that box as a trade when food is being given out. Simulate favourite foods. This is incredibly important. So if a family is having pizza night, there is definitely recipes for ketogenic diet friendly pizzas. So we really encourage families to try and keep sort of using and coming up with recipes that simulate the foods that they eat as a family, and also those favourite kind of foods. Giving choices. So allow your child to make small choices, because they're going to feel like their diet is restricted. So simple things like letting them choose, for the younger child, letting them choose their plate or spoon, or where they're going to sit to complete the meal. Another really important thing is positive language. So this is really important for children, especially adolescents and adults. So embarking on the diet. So we try and discourage use of words like this is really restrictive, this is really hard, this is really difficult to stick to. So using positive language like it's a magic diet, the diet is worth it, and praise your child for being compliant and reward with non-food related activities. So that leads me on to rewards to encourage compliance. So in younger children, rewards to encourage compliance can be really effective. So we encourage parents to tailor those rewards to what the child likes. So that might be, an example of that might be extra screen time or going out to the park. So we say never promise rewards that you can't give. So we've overheard families promising things like candy or something that's quite extravagant, but we know that the diet is something that needs to occur every day. So we say keep it simple and achievable. Rewards can be activity-based and fun. Apologies, we have another
Medical Emergency Team to Short Stay Unit, Level 2, Austin Tower, Gen Med Unit. Medical Emergency Team to Short Stay Unit, Level 2, Austin Tower, Gen Med Unit.
Okay, apologies. Preparing your child for school, kindergarten or childcare is also an important aspect of the diet. So you need to educate teachers and a school nurse, if there's one there, about ketogenic diet therapies. And often parents will ask us to go into the schools or over Teams or Zoom, do an education session, which we're quite happy to do. But I guess it's really important to educate teachers about why your child is on the diet, how the diet works, and when to seek medical attention or escalate care, like contacting the parent throughout the day. They also need to know that dietary compliance is essential to control child's epilepsy. So we kind of look at it as another drug. So it's really important that they need to be compliant, and we know that is really difficult in the school setting when there's other kids around eating all other foods. And it also is important to educate the teachers that the child needs to eat all their ketogenic diet food. They need to complete the whole meal. I thought I would include this slide because now that we can finally travel again or start planning for travel, we have families that are on the ketogenic diet and travel overseas and manage really, really well. And we know that planning ahead will help prevent any problems and ensure that travel and holidays are safe and enjoyable. So the diet doesn't stop when you're on holidays, and maintaining ketosis uninterrupted can definitely be achieved. So some of the tips that we give families planning on going overseas or going interstate, or even going on a simple holiday within the state, is planning the length of the journey. So will I need to take food? Will I have enough snacks? Also access to medical services. So whilst I'm away, if my child becomes unwell, will I be able to access medical services? So we often encourage families to get a letter which outlines their child or your own illness if you're on the diet and you're an adult, in case you need to seek medical attention whilst you're away. If you're going overseas, so custom regulations in different countries. So for overseas trips and domestic flights, we also encourage families to obtain a letter stating that they'll be carrying supplies such as food, scales and needles for finger pricks, and also make sure that they have enough supplies, especially for children that are enterally fed. Also accessibility of ketogenic diet foods. So food labelling and brands differ around the world. So one needs to be prepared that certain food groups may not be available. If you're required to take ketogenic diet meals on an aeroplane and they need to be refrigerated or heated up on the aircraft, it is advised that you contact the airline prior just to make sure that this is a possibility. So preparing for celebrations is really important, as it can be the most trying time for children, adolescents and adults to stay on the diet. So we encourage, particularly with children, for parents to talk with your child before the celebration so that they understand that there'll be lots of tempting food around. And also, if you're an adult, you need to prepare for social eating out and make sure that you can take your own food to that restaurant, because being engaged in social settings is really, really important. And we don't want to encourage isolation just because you're on the diet. So if you're having a celebration at your home, just avoid having those lollies lying around for guests to snack on, because they can be tempting. And also another good tip that a parent once gave us was to try and save a new dessert or recipe for use at celebrations only. So it's really considered as a treat. So we recommend that if you're interested in pursuing ketogenic diet therapies, please discuss this with your treating neurologist or contact your closest ketogenic diet team. So the following links may be useful as a guide to commonly asked questions and for further general information regarding the ketogenic diet and the modified ketogenic diet. Thank you for listening to us tonight. We've provided our email address if anyone has any further questions. Thank you. We'll just stop sharing our screen now.